Okay, ma'am. Good morning, ladies and gentlemen, the galaxy of intellectuals, our esteemed speaker, Dr. Rakesh Gupta, teachers, and my dear friends. How different is this morning? Well, not much. Just again, we are sitting in front of our devices, except that we are having this epoch making webinar on illegal drug abuse. Dear audience, you will yourself discover as our esteemed guest of this event indoctrinates us all together. It's my great pleasure and the first and foremost duty that on behalf of the Directorate of Student Welfare of Guru Gobind Singh Indraprastha University, I welcome you all to this epoch-making webinar. We warmly welcome you all to this informative program. Drug abuse is one of the most predominant issues nowadays. Our youth definitely needs superintendence on this issue, as the social media and the Bollywood have been making drugs a cool thing since quite some time. I would also like to appreciate the efforts made by Directorate of Student Welfare, especially Professor Manpreet Kang ma'am, the director, and Associate Directors Dr. Anjali Shakeen ma'am and Gulshan Dameja sir, for organizing such an essential event. I assure you that this program shall bring a paradigm shift in your mind about drugs. We feel honored to have with us our esteemed guest, Dr. Rakesh Gupta. Let, sir, were you saying something?
No,
Okay,
Gavinish.
okay.
You continue, please.
We feel honored to have with us our esteemed guest, Dr. Rakesh Gupta. Let me make you aware about his credentials. He did his MBA and MD in 1982 and 1989, respectively. He is also an alumnus of John Hopkins School of Public Health, Baltimore, and California University, San Francisco. He has more than 35 years of professional experience in Punjab as a PCMS officer. He has also served as a director in multiple government health services, such as Punjab Health Services. He's also served as a resource person for a ton of academic needs since quite some time. He's also represented MOHFW for consultations in the year 2016 and 2017. He's also been awarded the WHO Award in 2015 on World No Tobacco Day, Exemplary Services in the Medical Profession Award by SBI in 2019, Award of Honor by Punjab Red Cross as a Chief Coordinator Pan India COVID Tele Helpline in 2021, and many more. Well, the list is a long one. Without making much of your time, I would like to hand it over to Dr. Rakesh Gupta. Over to you, sir.
We welcome you, sir.
Yeah, thank you, Dr. Anjali, and thank you, Dr. Gignesh, for a very elaborate introduction. So I think we can have our presentation. So there's a small video regarding gateway drugs. So can you play it? So thank you. And may I have the next slide, please? Next. So I'll be talking about smoking cigarettes, hookahs, electronic cigarettes, tobacco chewing, which are all gateway to illegal drug use. So the basic component in them is the basic chemical is nicotine. Next. So we must remember the villain. These are the different types of smoking tobacco and the chewable tobacco and the hookahs. Next. So globally, I must tell you the burden of tobacco use because tobacco kills up to half of its users. So half of the people who use as intended, as proposed, they get killed because of the tobacco use. So low middle income groups, low middle income countries, they house over 80% of the world's 1.3 billion tobacco users. And more than 7 million, they are direct tobacco users, and 1.2 million people, they are exposed to secondhand smoke. So next. And 12.2% of the deaths in low middle income groups, they are attributable to tobacco. So nearly 2/3 of the world's smokers, they live in just 10 countries, and mostly 40% they live in China and India. Next. Tobacco, it is a risk factor for all kinds of 8 leading causes of death. So you can see, so most of the leading causes of death, they are attributable to tobacco use. Next. So the projected numbers of tobacco related deaths, you can see, so 82% of the world's tobacco related deaths will occur in low middle income companies. In 2030, 82% they will be in low middle income countries. And India is the second most important producer and consumer of the tobacco products. Next, please. So it is the second largest consumer and the second largest producer too. Next. So as I showed you earlier, so these are the smoking and the smokeless tobacco products. Next. And to the smoking, we can add these electronic cigarettes also. So luckily for us, in 2019 December, the electronic products and the similar products, they have been banned in India by an act of parliament that is called PICA, Prohibition of Electronic Cigarettes Act. Next. So burden of tobacco use, 71% they are non-users, but 18% are they are users of both types of the tobacco. 7% are smokers, and 4% are they use the smokeless tobacco. Next. In fact, like 4% they use both kinds of tobacco. Next. So this is the burden of tobacco use in India. So this is as per the Global Adult Tobacco Survey 2. And there has been a 6% decrease from Global Adult Tobacco Survey 1 and Global Adult Tobacco Survey 2. So the findings were released about 2 years ago. Next. Still 28.6% of the population is using tobacco in any form. The smokeless tobacco is the main culprit in India. So 21.4% of all the adults, they use smokeless tobacco. Next. The smoking tobacco is being used by 10.7% of all the adults. Next. So this is the burden of tobacco among the students in India. So there was a release of the fact sheet of Global Youth Tobacco Survey yesterday by our Honorable Health Minister. So I'll show you some of the findings. Next. So about 97,000 of the students were surveyed between the age group of 13 and 15, and some of students they were underage and overage. So 80,772 students, they were covered in the survey, and the overall response was almost 95%. Next. So there has been a decrease in the use of total tobacco, the smokeless tobacco, and in the boys and the girls also. So from last Global Youth Tobacco Survey, 14.6%, now it has come to 8.5%. In boys, it has come from 19 to 9.6%, and in girls, it has come from 8.3 to 7.4%. So because of the awareness by the government, by the NGOs, and by even the student bodies, the faculty of the universities, schools, colleges, so it has come down a lot. Next. So trend in current use of tobacco, the smoking tobacco and the smokeless tobacco. So it shows that the smoking tobacco, it has come from, it has reduced from 8.1 to 7.3% in almost 10 years. and from 9 to 4.5, 4.1% in case of smokeless tobacco in 10 years. So it is quite a significant decrease in prevalence. Next. So trends in selected indicators among the students. So because of the awareness campaign, students who thought other people's tobacco smoke is harming to them, so they are now well aware. 70% of students, they're well aware about the second-hand smoke. So you know, the first-hand smoke is the smoker who inhales the smoke himself is a first-hand smoker. The second-hand smoke is when the other people around the smoker, they inhale that smoke. So that is second-hand smoker. And there's even third-hand smoke, because the particulate matter, they get remained in our upholstery where we are sitting, the upholstery in the room, and even it clings to the clothes. So that is the third-hand smoker. And there's another dimension to it, that is the tobacco litter. So you see cigarette butts, they are thrown, the cigarette and those beady butts, they are thrown everywhere. And even the plastic pouches of the tobacco, the smokeless tobacco products there. So they create a litter. So that is the fourth dimension of this tobacco. And people who refuse to sell cigarettes due to age, the vendors. So it has increased from 44.9 to 54.7. So that is also quite significant. And exposure to tobacco smoke at home has also decreased from 36.4 to 11.2. So it is from 2003 to 2019. In 2003, our Cigarette and Other Tobacco Product Act that was enacted by Parliament. And so you can see how significant the effect of this awareness and the act, the anti-tobacco laws is there. So the exposure at home has decreased. So people, they normally try to avoid smoking at homes. Next. So the students who thought other people's tobacco smoke is this, I think I have already covered. So next please. Next. So tobacco that cause us our health. So you see 40% of all the cancers and 90% of the oral cancers, they are attributed to the use of tobacco. And majority of the cardiovascular and lung disorders, they are also because of tobacco. 38% of the tuberculosis deaths, they are associated with tobacco use. And presently, more than 13.5 lakh people, they lose lives per year and 3,700 per day. So you see, it is quite significant. 3,700 per day, people, they lose lives just because of a preventable cause, that is use of tobacco. Next. So tobacco growers and workers, they suffer from green tobacco sickness. So it is not good for growers also. And the beady rollers, they are affected by the tobacco dust, bronchitis, tuberculosis, asthma, gynecological disorders. They can occur in females who are the beady workers. And they are very poor people, and they are very much exploited by the tobacco industry. So their food tastes bitter because of the stains of the leaf on the palms, and they are very poorly paid, much below the minimum wages, and they're trapped in a vicious cycle of poverty. So you see, it is not good for the tobacco producers, the growers, and the people working in the tobacco factories. Next. And as I told you, that tobacco causes our environment also, that causes our environment. Tobacco crop is fertilizer and insecticide intensive. So it pollutes the soil and water, and it also causes deforestation. 8 kg of fuel wood is required for curing just 1 kg of tobacco. So you can well imagine how much deforestation must have been occurring because of the tobacco growing in production. And as I told you, the plastic pouches, the cigarette butts, they create a litter. And then another dimension is the use of e-cigarette. Though in India it is banned, but in many countries it is still prevalent. In India also, the e-commerce sites, they are still selling these banned products. Though under the PICA 2019 Act, the advertisement of the electronic cigarettes and the sale is totally banned. Still, it is being made available. And we have already complained to the Government of India, the Ministry of Health Affairs, and Ministry of Home Affairs to please check this this violation of that. Next. So these are the total economic costs attributable to tobacco use. Our finance minister, a few days back, she told that the total economic costs attributable to tobacco use in the year 2017-18 for persons 35 years or older amount to INR 1 crore 77 lakh 177 lakh crores actually 1.77 lakh crore. This is the cost of the treating the tobacco related diseases, and the earning is about 1/3. So earning from the taxes is just 53,750 crores. So you can see it is not too profitable for the government too, because tobacco industry, they always tell that the government earns a lot from this the sale of tobacco, but it is not the case. So the cost of treating diseases 3 times the cost the funds which are generated by sale of tobacco. Next. So the burden of tobacco use, as I told you, it is high in Indian subcontinent, and it is risk factor for the non-communicable diseases. So 14.6% of the school students, they use tobacco in India, and 21.4% adults, actually 15 years and above, they use smokeless tobacco, and 10.7% they smoke tobacco. So overall prevalence is 28.6%. So it varies in India, in different states, it varies from 9.7% to 64.5%. So we need to focus on our student population. So the school students, the university students, the college students, and some of the states, the high prevalence states. So we need to focus on them. And tobacco use, as I told you, it costs our health, it costs economy, it costs environment and the health of the workers. So can you please play it's a small video by Ministry of Health and Family Welfare. So it summarizes all I've told you.
Every year, over 13 lakh deaths are attributed to tobacco use, which means 3,500 people die in India every day due to tobacco use. Tobacco use impoverishes 150 lakh people annually due to huge out-of-pocket expenditure arising on account of treatment of tobacco-related diseases. The total economic cost attributed to tobacco use was INR 1,04,500 crores in the year 2011, which makes 1.16% of India's GDP in that year. This huge consumption is also responsible for deforestation, with loss of thousands of hectares of forests every year. Use of pesticides during tobacco farming is also a reason for soil depletion and water pollution. Cigarette litters and smokeless tobacco packets contain plastic, which degrades the quality of oceans and seas.
Smokeless tobacco is associated with a significant risk factor for a number of diseases, not only respiratory diseases, but even for diseases which are outside the lung. There is enough data which has been accumulated in India over the last few years, which shows that whether it be BD smoking or whether it be hookah or whether it be a cigar, they are equally harmful. So besides the lung, it is associated with a large number of non-communicable diseases. If you start looking at data from India, there is an increasing number of NCDs which have started happening, and the burden of disease has shifted more towards non-communicable diseases rather than communicable diseases. And this shift of the burden of disease is related to lifestyle. And one factor which has contributed to that is the use of tobacco. There is actually a dual effect or a double effect, that if you're exposed to smoke, or you're smoking, whether it's be direct or indirect. So we have a lot of passive smoking also which occurs in the family. Because of that, you're also exposed to indoor or outdoor air pollution. Your lung function will decline much more rapidly than it would have done with either of the two alone.
India has been a forerunner in its efforts to control tobacco use. Internationally, our participation has been very active in FCTC. We have hosted COP7, we have been head of COP8. We have a global knowledge hub for smokeless tobacco in India. We have a special act for tobacco control in India since 2003. We have a statutory warning on cigarette packs, which is 85%, with the quitline number 1800 11 2356. We do regular GAT survey to assess the impact of our policies. And depending on the results, we also then try to do mid-course corrections in both policy and our interventions. This whole awareness campaign cannot be done without community engagement. So under Ayushman Bharat, now that 150,000 health and wellness centers are coming up, through these health and wellness centers also we've made a calendar of events, and in these events tobacco control, awareness on what tobacco can do to your health are also incorporated. Right at the grassroots level, our ashas are trained in what are the harmful effects of tobacco, so that they can, when they visit families, when they hold meetings, that message can be spread. A very important intervention on the preventive side is that there is screening for NCDs. And while, as you know, that tobacco affects NCDs, and in India, we have found that 62% deaths are because of non-communicable diseases, and out of them 55% are immature. So we do preventive screening of 30 plus population for diabetes, hypertension, 3 cancers: oral cancer, breast cancer, and cervical cancer. So when the survey is done of people with risky behavior, then use of tobacco in any form is also one of the important tick marks for risky behavior that our ashas are educated upon. We have done a lot for tobacco control. We need to do a lot.
So,
but it is
Jagdish, I think you can stop the video.
Participation of our self-help groups, of our
So she was our ex-health secretary, Madam Preeti Sudan. She has done a lot for tobacco control. And I may tell you that, in fact, all of us, we are stakeholders in tobacco control. So whether we are doctors, non-doctors, students, teachers, so all are actually stakeholders. And as has been depicted in the video, so Dr. Guleria, he's the director of the AIMS, he also told you that any kind of disease from head to toe that can occur, because the primary culprit in the tobacco is nicotine, and nicotine, that is a vasoconstrictor. That means it constricts blood vessels, and our hair also, they need blood supply. Our toes, they need blood supply. Heart, brain, then it affects almost each and every part of the body. So we can play the next, you can turn on the next slide, please.
Mothers.
You can stop this and then. Yeah. So next slide, please. Next. So why nicotine? It is a tobacco that is a gateway drug, as it was already depicted in the that video which we showed. First of all, tobacco products, they could act as a gateway drugs. They open the door to all kinds of illicit drugs. Nicotine, the researchers, they have actually found that makes the brain more susceptible to cocaine addiction. The finding that suggests that lowering smoking rates in young people might help reduce the cocaine abuse. So you see, if most of the people who graduate to the cocaine, marijuana, and other heroin also, so they start up with tobacco or cigarette smoking. And the scientists, they have recognized that cigarettes and alcohol, there is a risk for later use of illicit drugs like marijuana and cocaine. So next slide, please. So next please. Yeah. So there are many opportunities as per WHO Empower approach. So we need to monitor the use of tobacco and the prevention policy. We need to protect people from tobacco use by avoiding smoking in public places. We need to offer help to people to quit tobacco use. And we need to warn about the dangers of the tobacco. As you know, 85% of the tobacco packs, they are covered with the Victoria Health warning. And even an uneducated person can see the warning on the cigarette packs. So we also need to enforce ban on tobacco advertisement, promotions, and sponsorship. So as some of you might know that some of the tobacco companies, they were sponsoring these cricket tournaments, and they were sponsoring bravery awards. There was red and white bravery awards. So now you won't see this. And raising taxes on tobacco, it is a very good strategy to reduce prevalence, because you see the younger children and the unemployed people, they can't afford tobacco if it becomes expensive. Next. So these are the approaches by the WHO. So for different people, we need to have different strategy to avoid using or quitting tobacco. So those who have not started, we have to apply different strategy. Those at risk, those who are vulnerable, early initiators. For the first three, those who have not started, those at risk, and those who are vulnerable, we need to do a lot of this IEC activities, and the teachers, they need to tell about the harmful effects of the tobacco to students. And we need to have a different strategy for the early initiators and persons who have low dependence, persons who have severe dependence, and persons with medical or psychiatric comorbidities. So we have to apply different strategies at different stages. Next. So the current opportunities with us are the Ministry of Health and Family Welfare. They have a program of M cessation. You need to give a missed call on 011-2290-1701, and you get all kinds of messages, text messages, so that slowly and stepwise you can quit tobacco. And there's also a kit line number 1800, as was told by our former Secretary Health. So 1800-112356. This is the quit line number. So anybody who is a smoker or a tobacco user or an e-cigarette user or a hookah smoker who are addicted to these products, they can use this quit line number. Next. So the preliminary experience with the M cessation has been very good through National Health portal in last 6 years. So we had about 1.8 million calls in 1 year. So it shows that people who are users of tobacco, they actually want to quit. So that is the reason so many people they are calling. But the quit rates are not very good because it is more addictive than even heroin. The nicotine is a very addictive drug. So better is not to start. But if you start or if you are an addict, then you must follow the protocols. Uh, the counseling methods are there. Then there are nicotine replacement therapy in the form of tobacco gums, tobacco lozenges, then other drugs like buprenorphine, bupropion, and varenicline. These are the drugs which are used for people who are too much addicted to the tobacco. So next. So we have low access to tool and aids to quit tobacco. So 1/3 reported counseling or for nicotine replacement therapy, and 1/5 they had used other medications, as I told you, bupropion and varenicline also. And access to quit line or specific support for cessation is required. So as I told you, National Tobacco Quit Line is available. So dear students, I'll like you to use these quit lines if some people they are addicted to tobacco or they are using tobacco, and you can use this quit line for your friends and for your family members who are addicted to tobacco. Next. So now actually the tobacco cessation services, they are available in most of the medical colleges, and they are also available in most of the dental colleges. So we have 306 dental colleges in all in India, and it is now compulsory to have a tobacco control, this tobacco cessation services in the, and as you know, Dr. MOHFW, your Vice Chancellor, so he was instrumental in this, actually introducing TCC services in the dental colleges throughout India. Next. And in private sector also, you can find psychologists who can help you out in quitting. And there are doctors who are practicing tobacco cessation. So people, they can take help of that. So there is an interrelationship between the tobacco and the other risk factors and NCDs. So the tobacco, it can cause cardiovascular deaths, it can cause cancer, it can cause diabetes, it can cause mental health disorders, it can even cause stroke. So you see, it is a very dangerous habit, so better not to start it. Next. So there are actually vast opportunities for us to help our youngsters to quit smoking or tobacco use. And we can include in teaching curriculum wide many of resources to quit. They are available now in India. And we can expand the services in group and community settings. And actually now Ministry of Health and Family Welfare, they are training health professionals in brief counseling, and now there's increased accessibility to medication also. Earlier these NRT and other drugs, they were very expensive. Now they are within reach, and we have to extend the reach to completely unserviced areas. Like you see in the prisons, the people, they are addicted to drugs, so we need to take it to them also. Tobacco cessation experience will have important lessons for policy and the programming of for other addictions too, as it is a gateway drug. Next. So for assisting tobacco cessation, there are very simple methods, 5 A's we call it, for our health workers. So health workers, they are trained to ask about the tobacco use, to advise what to do next, and to assess their addiction, whether they are physically dependent or they are psychologically dependent, and then they must assist them. So how to take treatment for this tobacco habit, and they must also arrange for the tobacco cessation. Then the 5 Ds that help with the smoking cessation, that is, we must, if we have a craving, we must delay the craving, we must distract ourselves. We can do meditation, we can play. Then we need to drink water. Deep breathing also helps in reducing the craving for tobacco. And we need to discuss with our family, our friends, and our doctors if we are addicted to this habit. Next. So we must now pledge to quit tobacco. Quitting smoking is no easy fate, and you have to be very brave and courageous for committing to this goal. And we need to set a quit goal. Giving yourself a short period to quit will keep you focused. So it is not like that I'll quit on the New Year day. So it is not like that. You can start quitting even today. Tell your friends, families, co-workers, and they will support you and encourage you to not give into temptations like cravings. And we must also anticipate challenges when we quit tobacco. Next. So, Dr. Anjali, this is a small no tobacco nicotine pledge. And if you can read it out, so it is for all of us. So can you read it out, please?
Yeah, sure. Thank you, Doctor. So it's dear students, dear audience. So now I'm taking this pledge on the behalf of all the students and all the faculty from the Guru Gobind Singh Indraprastha University. So I, Anjali Shaukin, promise to not smoke on or use any tobacco nicotine products, including e-cigarettes, now and forever. I will do my best to encourage people who do smoke or use tobacco products to quit smoking and using tobacco products. And I will do my best to support them as they try to quit. So this is the pledge on the behalf of all the students. So thank you. Thank you, Dr. Rakesh.
So thank you, Dr. Anjali. So as I told you, so we are all stakeholders and we need to take a pledge and also motivate others to take this pledge. And we do not use this tobacco, which is a gateway drug. So next, please.
Yeah.
So thank you all. Thank you, students. Thank you, Dr. Anjali. Thank you, the organizing team. Thanks a lot. So we are now open if anybody has a question, or they can even send me question. You can send to Dr. Anjali if you have any questions, and I can answer those questions on mail as well. But right now also we are open for discussion.
Yes, students, if you are...
I would like...
yes, Gagnish. So students, you are having some questions, so you can ask. You can unmute yourself. Banipreet, just see the settings. You can change the settings so that if anybody wants to ask questions, so they can unmute themselves and they can ask.
Ma'am, we can take the questions in the chat box.
Yeah, that can be the alternative.
Yeah.
Yes, ma'am. Gagnish can ask questions from sir.
Yeah. So any questions, students? At least you can say yes or no in the chat box so that we can see whether you are asking some questions or not.
So Dr. Anjali, if there are lesser number of questions, that means we have made ourselves very clear.
Yeah, sure.
And
Yes.
I think students are motivated.
Yeah,
so
and
I'm sure they will not start with the practice and they will motivate others to quit if they are already tobacco users.
Yeah.
Anushka, she's asking a question.
Yes. And Namita Rana is also asking.
Yeah.
So Gagnish, can you read out the question?
Oh, definitely, ma'am. Sir, how would you suggest we get the students and other people to listen to us about this, about leaving the tobacco products?
How to? Can you repeat the question?
Sir, how do we suggest the people who are the addicts who are using the products?
Okay. So I think we need to tell about the harmful effects. As I told you, so the nicotine that affects you from head to toe. So you lose your hair, you can have stroke, you can have eye problems, you can have cataract, you can have, there's a condition called age-related macular degeneration. So prematurely loss of vision is there, and there's poor orodental hygiene, and oral cancers are there, throat cancer is there, and then your heart gets affected. So you can tell about the harmful effects, and you must also tell that it is gateway to other addictions. So I think most of the people, they get, they get motivated to quit smoking or tobacco. So I think this is the way you can motivate them. And I might just tell you a story. Actually, Dr. Pratima Murthy, she's director, NIMHANS. She said that there was a doctor, she did not name the doctor, and I also don't want to name the doctor. And he was a very famous surgeon. He was a chain smoker. And Dr. Pratima, she tried hard to get him to quit smoking, but he couldn't. So he went to US, and his grandchildren, they were very much disturbed because of his smoking habit, and they pasted a poster on the toilet door that, "Granddad, please don't smoke inside, so we get disturbed." So when he came back, he asked Dr. Pratima to help him quit smoking, and now he's off smoking. So sometimes a small thing like this, it motivates people to quit. So, and there's another thing I may tell. I was just listening to Sadhguru last evening. He said that now we are making cars which are smokeless, and our human body is not meant to smoke, and we are making ourselves as smoking machines. So why make our own body a smoking machine when we are making our cars smokeless? So I think such things can hit you.
Yeah.
So these are the ways you can motivate people to quit. So
Yes.
is there any other question?
Yes, sir. I think there is one more question
Yeah.
from Anushka. So she is asking, their other friend says, let's go all these. What I said is rubbish. So what I do is that case. What I can do in that case. If so basically, Anushka, you want to ask that if your friend says, oh, this is rubbish, let's try all these things. So in that case, what we can do? So I think this is the question which the Anushka is asking, sir.
So actually, the answer is the same which I told earlier.
Yeah.
And there is a lot of peer pressure. We must agree that there's a lot of peer pressure. The people who are smoking or using tobacco, they motivate their friends to pick that habit also. Especially this is important with the hookah bars. You see, in Delhi also, everybody must be aware there are a lot of hookah bars. Though hookah bars, they are not given any permission. They are an illegal entity. They are illegal under cigarette and other tobacco product. They are illegal under Food Safety Act, the Food Safety Standard Act of India. They are illegal under Poisons Act. They are illegal under Juvenile Justice Act. They are illegal under IPC Acts 268, 269, 271. But still, we see that there's illegal running of the hookah bars, even in Chandigarh. So though the people are very much aware, I'm from Chandigarh, and people are very much aware, and even the Chandigarh administration and banned under the Epidemics Act, because you see, it is a community activity, the hookah. The single mouthpiece is being used by many people around that hookah. So it is very dangerous. So the COVID infection can also transmit. So you see, there is a lot of peer pressure, but we must be aware that these are illegal. E-cigarettes are illegal entity. The tobacco smoking, it has to be regulated. There are 4 acts under Section 4. The smoking in public places is prohibited. You see, all places they are public. Even if you're home, in your home, somebody, your children, your wife, they protest about your smoking, then it becomes a public place. So almost all places are public, but there are exceptions. There are some restaurants in which there's a sitting capacity of 25 people, or there's capacity of 25 rooms in a hotel. I think it is 25 or 50. I'm just forgetting. So there you can have smoking rooms, and in airports also we can have smoking rooms, but they are very specific now for designated smoking areas. Then there's section 5, under which there cannot be any advertisement of the sponsorship or promotion of the tobacco, right? Then under section 6, no child is allowed to sell tobacco under the age of 18, and no minor can sell or buy tobacco, right? And there cannot be any tobacco shop within 100 yards of an education institute. Education institute doesn't mean only schools, it means colleges, it means universities, even the coaching classes, they're included. So you must be aware that there cannot be any tobacco vendor within the premises of the institute.
Yeah.
Under Juvenile Justice Act, there is very strict punishment if you even offer a minor tobacco or alcohol or any addicting agent. So we have very good laws, very stringent act, but loopholes are always there. But we must be vigilant. As educated people, we must be vigilant about the laws.
Yes, and I think, sir, that is a dire need of the hour, that we all should be very vigilant so that these things can be reduced and we can make our students more sensitized towards these issues.
Yeah.
Yeah. So thank you so much, sir.
So any other question? Or I think we can wind up.
Gagnish, just see.
Yes, sir. There's one more question. The use of tobacco in moderation is more harmful than active smokers or not? People generally justify their tobacco usage by using it in moderation.
No, actually, there is no safe level of tobacco. You see, there is absolutely no safe level. For alcohol, some people, though I don't agree with that, but some of people, they say that there is, if you take in moderation, it may be good. But I must tell you, for tobacco, there is no safe level. Even one cigarette can do harm. People, they get cancer by use of smokeless tobacco even after 1 month. So there's no, so you can't say ki in moderation it is okay.
Yeah.
And there was another question about the second-hand smoke. Somebody was saying that it is like onions. It affects you and the people around you. Definitely. So it is a good analogy.
Terminology, a good terminology the student has used.
So actually, the second-hand smoke that is equally harmful than the first-hand smoke. So we must be sure that nobody is smoking around you. And the third-hand smoke I talked about, it can even kill infants. There's a sudden infant death syndrome. It is called SIDS, and people, the infants, they have died actually because of the third-hand smoke, which has been created by a smoker father or a smoker relative.
Yes. So thank you so much, sir, for answering all the questions very patiently. And I think the session was very informative. And now I invite Gagnish to deliver the vote of thanks.
Well, thanks a lot, sir, for coming. We really got to collect a ton of statistics on tobacco, cigarettes, and e-cigarettes, as well as we collected the ways in which the addicts can move towards quitting tobacco products. We were also informed about the legal implications of drug abuse, and it has really been a great webinar, sir, where you also brought other eminent speakers as a part of your presentation and videos. And on behalf of Directorate of Student Welfare of Gobind Singh Indraprastha University, I would like to thank you, sir, for edifying us in such a crucial webinar and elucidating us on the topic of drug abuse. Thanks a lot, sir.
So thank you, organizing team, and thank you, Dr. Anjali. Do convey my regards to Dr. Mahesh Verma.
Sure, sir. Sure, sir. And we are very grateful that you have said yes to be present as a resource person in this webinar Of course, we know that you are having the very busy schedule, very tight schedule, but in that situation, you have said you have sent your consent. So we are really grateful, and our sincere thanks to you, sir.
So thank you, Dr. Anjali. Actually, we are tobacco control addicts, you see.
Yeah.
So the tobacco control is also an addiction. So you may also get addicted to it after listening to this webinar again. So thank you all. Thank you, organizing team. Thank you.
Thank you. So thank you so much. So thanks, dear students, for joining the program. And thank you all my colleagues and students for joining. So now I think we are ending with the program. So thank you, everyone. And thank you, Banipreet. Thank you, Siddharth and Rajneesh, for taking all the initiatives for the program. For the, you can say you are the part of technical team and the host for the day, Rajneesh. So thank you. Especially thanks to all these three students.
Thank you, ma'am.
So thank you.
Thank you.
Thank you, ma'am.
And do share the recording with me and with all the students and your friends also, right?
Yeah, sure, sir. Sure.
Okay,
Yes,
bye.
sir.
Bye.
Bye.
Bye.